The way that providers can work better with families is, first of all, to establish a relationship and to help families understand the difference between health and health care. Because health care is that interaction between the provider in a clinical setting, but health is where things happen at home. And are they having the right kind of nutrition and exercise and activity and good decision making in terms of health interventions? So I think the way that providers can really engage families is to start that relationship of understanding what is it about their family that makes them unique. Also, how families feel engaged is when they're simply asked questions as a partner. And when we can look at families as being equal contributors to the health outcomes of their kids, it changes the whole ballgame. So engaging families by asking questions, what are the strengths of their family? And one of the most critical decisions, or one of the most critical questions I think that providers can ask families is, how do you make decisions about healthcare in your family? That's a very culturally responsive question to ask a family, and that will help them be engaged. And what we learn from families when we ask that question is, before we make any decision, we talk to the grandmother in our family. We take this to our elders, and they help us make decisions. Some families will report that the decisions are made by the male figure in the house, or sometimes it's clearly a maternal kind of a decision. But just opening that question and asking, what's the culture of your family when it comes to making decisions is huge, and that will lead to true and authentic engagement and partnership with families.